Hi, I'm Dr. Veera Gupta, and we're going to talk about high blood pressure. Now, some people will have genetically high blood pressure. Those people definitely see your primary care physician, make sure you're on the right stuff to lower it. For the rest of you, there's a lot of easy ways to lower your blood pressure. Earlier this week, I had a patient who came in here with 200 over 100 blood pressure. By the time we were done, she was at 120 over 80. What spikes blood pressure? Physical pain can spike it. Mental pain can spike it. Being inflamed can spike it. Heredity can spike it. A lot of things can change your blood pressure very fast because a lot of things can change the cardiovascular system very fast. If you have ever been embarrassed and your face turned any kind of red color, that was the cardiovascular system vasodilating the vessels in your face to turn you red. So it doesn't take a lot to change that system. So if your blood pressure is high, here's the first thing I'm going to tell you. Cut down on your salty foods because that's an electrolyte. It's holding fluid into you. So if you're a salt person, get rid of the potato chips. The second thing I'm going to tell you, every time you're talking, every time that you're engaged, you're using the sympathetic nervous system, which makes you run, go. To calm the blood pressure, you've got to calm that down by engaging the parasympathetic nervous system. The easiest way to do that is through breathing. My favorite technique to have patients do is to have them lie face down on the table and breathe in for a count of 4 and breathe out for a count of 8 while I have pelvic blocks or something adjusting them. Obviously, if you're at home doing this, just lie down. Breathe in through your nose for a count of 4. Breathe out for a count of 8. Do 3 sets of 12. Keep doing that. The big thing you want to do is focus on your breathing because that can help you. The third thing I'm going to tell you is probably the most important. Cut down on your sugar. What happens is that when you have a blood vessel, if you were to cut it this way, it would look like a donut, and the inside lining of that donut is called the lumen. It gets cuts in it from the sugar, and then cholesterol plugs those cuts. So instead of that blood vessel being nice and elastic, now it's really crusty. So it can't then change its size and move the way it should. So if you do those couple things, you breathe, you cut down on the salts, and you cut down on the sugar, over time you may be able to lower your blood pressure. I hope this helps.